and you assess the patient and you start resuscitative efforts and you've called for help, wouldn't you use that cell phone to call 911 as quickly as possible?
Yes, but in calling 911, you need to know the address. You would need to be able to make sure they could access the premises. And my understanding is...
So is it your testimony, because there was a gate around the house, that excuses Conrad Murray not calling 911? Is that your testimony? Because you've mentioned this gate a couple times now.
No, it doesn't. It doesn't at all.
Okay. Then we can set aside the gate, right? Because that has no bearing on Conrad Murray's need to call 911 as soon as possible, correct?
Well, I think that's the reason he called the security individual, Michael Amir, to inform him that he needed emergency medical assistance.
Okay. And you realize when he called Michael Amir Williams, he didn't tell Michael Amir Williams to summon emergency medical assistance. You do realize that, don't you?
If that's what you say, yes.
Okay. Wouldn't you agree that it's much quicker to call 911 than to call someone's personal cell phone number, have it ring through to voicemail, and then leave a message on that voicemail? Wouldn't you think it would be much quicker to simply call 911 and even put the phone on speakerphone and continue with your resuscitation? Wouldn't you agree with that?
Well, you can have people on speed dial and call them even faster than 911, so I think certainly 911 is easy to dial. You're absolutely right.
There's no justification for what Conrad Murray did in failing to immediately call 911, is there?
As I said earlier, I think he should have called 911 sooner. I do not, however, think it would have made any difference in the outcome of this case.
Now, you commented, let's strike that. After if you personally came upon Michael Jackson in that state where a pulse was felt and you assessed the patient and you started resuscitative efforts, how long would it take you to decide in that setting in a bedroom in a home that you needed to call 911?
Are you saying if I felt a pulse?
Well, Conrad Murray said he felt a pulse, yes, so that's what I'm saying.
He said he felt a thready pulse.
He said he checked the pulse oximeter and it read 122, and then he felt the femoral pulse and he felt a thready pulse, correct. In that situation, if you came upon those facts, how long would it take you to decide that you should call 911?
Well, again, if I came upon that situation and I was ACLS certified and a cardiologist, I would immediately start resuscitating the patient and call 911 shortly thereafter.
What's shortly thereafter?
3 to 5 minutes, I would guess, if you ask me for a number.
In this type of situation where paramedics are eventually called and they arrive on the scene, doesn't a doctor have a moral and ethical obligation to reveal all medicines to that responding emergency personnel that have been given to the patient that could affect the treatment?
I think in general we try to recount all the events, but in an emergency situation, as happens in hospital environments as well, it's often difficult to recall details in that kind of situation.
Is it your testimony that the failure to mention propofol to the paramedics was an inability to recall details? Is that your testimony, Dr. White?
Well, I'm just saying details can be overlooked. I'm not saying it's appropriate, but I don't think it was done in a devious fashion.
So I just want to be clear, you think it was just a detail that was overlooked when Conrad Murray failed to advise paramedics he had been administering propofol? Is that your testimony? It was a detail that was overlooked?
I don't think I used those words. Propofol, a small dose of propofol could not be reversed. It's
Okay.
not like benzodiazepine.
Did you understand my question to ask you if propofol could be reversed? Is that how you construed my question? Is that how you construed my question?
No.
Okay, then please listen to the question and please try to answer my question. Is it your testimony that Conrad Murray's failure to inform the paramedics that he had administered propofol was simply a detail that had been overlooked? Is that your testimony?
I think it was something that he overlooked.
Okay.
Yes.
Having time to ponder it and think about it and ride along in the paramedic's vehicle while Michael Jackson lay on a gurney, and then arriving at UCLA, was it still then another detail that he overlooked at UCLA when the emergency room doctors specifically asked him what had taken place? Is that your testimony, that that again was a detail that was overlooked?
Well, it was obviously overlooked. He didn't tell them.
Well, not obviously. It could also be a lie, correct? Correct? That's another option.
If you say so, I guess, yeah.
That's another option, correct?
It's an option, yes.
Thank you. Now, you said in your report, Dr. White, that in your opinion this was, as you said here today, cardiopulmonary arrest, and you characterized it as that the central nervous system depressant effects of this combination of medications can produce significant ventilatory depressant effects as well as upper airway obstruction, parentheses, due to relaxation of the pharyngeal musculature, correct?
You mentioned a report. I didn't actually write a report. I wrote a letter. Are you referring to the letter to Mr. Flanagan?
This is the only thing I was ever given, so whatever you want to call it. This 3.5-page document was the only thing I ever received from you. You want to call this a letter or a report?
It was a letter.
Okay, this is the only thing I have. So this was what documents your findings, correct?
No, not at all.
Is there some other information, reports you've given to the defense that you didn't provide to me?
Not in writing, no. But I've certainly conveyed my evaluation of materials to the counsel over the phone and in personal
What do you want to
conversation.
refer to this as, a letter or a report?
I think it's a letter.
Containing your findings at the time regarding this case, correct?
It contains some preliminary thoughts on this case, yes.
And this is the only document you've ever provided, is a document that contains preliminary thoughts.
Correct.
And in this letter containing your preliminary thoughts, you state that it was likely acute cardiopulmonary arrest where the central nervous system depressant effects of this combination of medications can produce significant ventilatory depressant effects as well as upper airway obstruction, correct?
I don't have the document before me, but it sounds like something I may have written, yes.
Would you agree that the risk of adverse drug reactions increases when combinations of sedative and analgesic drugs are administered?
When combinations of sedative and analgesic drugs are administered, yes, I would.
And that the potential for compromising the respiratory system results from depression of esophageal and laryngeal reflexes, upper airway obstruction, and depression of central hypercarbic and hypoxic ventilator responses. Would you agree with that statement?
Correct.
And although benzodiazepines may be used as an appropriate, procedure of sedation or anesthesia, you're well aware of the contributory effect that these drugs can have, and that it increases potentially the dangers of what is being administered. Would you agree with that?
You were earlier referring to sedative analgesic. That's very different than just talking about sedatives. I'm not aware of studies that have looked at the effects of prior benzodiazepine administration on ventilatory response to propofol, for example.
Is it your testimony that the prior administration of, for example, lorazepam and midazolam, is it your testimony that does not increase the risk in any way to respiratory failure?
As I stated earlier, it depends on the time interval following their administration.
So there is a risk, but it depends on other factors. But there is a risk, correct?
There's potentially a risk, but it's only theoretical, and it depends on, or it assumes that that time interval is fairly short and the blood levels of the benzodiazepine are high.
You said it's a theoretical risk, but you opined on Friday that because, in your opinion, Michael Jackson swallowed lorazepam pills and then quickly injected propofol, that he essentially killed himself, correct?
I suggested that one of the possibilities is that there was a high concentration of lorazepam, which I believe was measured at autopsy, and if one then administered very rapidly propofol, you could achieve a cardiorespiratory arrest. Certainly an arrhythmia could occur, and this could result in very rapid demise of a patient.
Who's responsible for bringing propofol into Michael Jackson's home, in your opinion?
Well, Conrad Murray certainly purchased propofol, but I understand Mr. Jackson had his own supply as well.
Really?
Correct.
Where is that in the police interview by Conrad Murray?
Well, I had heard that...
Objection.
Okay.
Non-responsive. Where is that in the police interview?
Just a moment, please. Sustained. The last partial answer stricken.
You keep throwing out these kind of rehearsed lines, I think. My question is, where is that?
Just a moment, please.
Objection, this argument.
Sustained.
Please.
Ask a proper question. Thank you.
Where in Conrad Murray's statement to the police is that reflected?
I don't have the report in front of me. I reviewed it in February, and as I indicated, I've had two lengthy conversations.
Objection, motion to strike. Would the court admonish the witness?
The objection is sustained. The answer stricken. Disregard, please. May I ask a favor, ladies and gentlemen, if you could just leave us for a few moments, please? Remember the admonishments. Don't get too comfy. I'm just going to ask that you go into the jury room. Thank you.